Hello and welcome to Everyday Medicine. I'm Dr. Luke and I'd like to thank you for joining me on the podcast series where we share conversations with colleagues, exploring their special interests in medicine and bringing insights, ideas and advice which I hope will be applicable for your medical practices. This is part 2 of functional breathing, maximising your potential through advanced breathing technique with a very expert, Mr. Allan Abbott. To welcome you to the podcast. I want to ask you, just like the applications, then, tell us a little bit about the applications of breathing training. So now we're thinking about the nose, light, slow, diaphragmatic breathing. Tell us a bit more about the applications.
For breathing?
Yeah.
For exercise?
Yeah, and how we might apply that to, say, exercise. Because one of the things that I was interested in with you was, using the altitude training, you'll come to that in a moment, to try and improve your performance. So, it's very important for us all to be aware of how to breathe properly because most of us aren't, me being one of them. But tell us a little bit about how we might use these techniques.
Okay, I will. In submaximal exercise, aerobic exercise we're talking now, should be able to nose breathe in zone 2. If there's different classifications of levels of training. A lot of people understand zone 2 as being submaximal endurance training, okay? So maintaining your training heart rate, not going to maximal heart rate.
Is that like 75% of your maximal heart rate?
Roughly
that's what we mean by zone 2?
Look, there's flaws in it, but if you want a sort of guideline, 220 minus your age and then train, your training heart rate, 75% of that.
Yes, okay. Yeah. And that'd be zone 2?
Yeah, that'd be zone 2.
Because most of us can, with a bit of practice, hold that for quite a long period of time.
Yeah. Without a doubt.
Yeah.
So I remember years and years and years ago getting a training program from a Norwegian cross-country ski coach who lived in Australia. Have I told you this?
No. I'm interested in hearing it.
So I said to him, look, I want a training program because, I want to cross-country ski and I'm going skiing for 5 weeks and all that sort of stuff.
Which you'll be doing that at the end of this week?
I will be, but not for 5, unfortunately. And anyway, so...
I feel like rock hopping, hopefully.
Yeah, rock hopping. I said to him, that's what I want. So he developed this. Now I'm going back, good Lord, it's a long while. It's quite a number. Think of a decades in counting between, say, maybe 3 and 4 decades, somewhere back there. Anyway, doesn't matter. He said...
You're like Methuselah.
I know. He said, here, this is what you've got to do. Basically, we did long, slow distance running, long, slow distance. So we'd run for 3 hours. Right? Oh. That was the long, slow distance training.
Yeah, okay.
Then we'd do some interval, more high intensity training. Right. That was hill bounding with poles up a hill. So you would start at the bottom and you'd bound up the hill with your poles, turn around at the top, and the walk down was the recovery. Mm. So then you'd bound up again and the walk down was recovery. So possibly 80% of the training was LSD and the other was high intensity. Right? Only recently I was...
LSD being zone 2?
Yeah, long, slow distance training.
Zone 2 or zone 2?
Zone 2,
Zone 2 minus?
Zone 2, zone 2, easy running, yeah.
Well, that's would have been ahead of the time, would it not?
Well, I don't know. See, the Norwegians are pretty up on this.
They're good at triathlons, Alan.
Yeah, and again, I was just going to say, I was watching a TED talk by a guy called Dr. Seisler, and he's a physiologist, and he went over to work with the Norwegian cross-country skiers, and he said, these people, we're working them 80% zone 2, 20% high intensity. Mm. That's what Chris Heller was doing, 30 years ago. Mm. Mm. But obviously they've refined it a lot. And he talks about...
Did you take this to the Australian Olympic team?
No. He talks about going out, because he's a runner, goes out into the forest in Norway for a run. And he spots one of the girls he had in the lab running. And they're running the flat. She's running ahead of him. She gets to the hill and she walks up. He said, normally what we would do, we'd get to the hill and go flat out, sprint up to load. No, she goes up slowly, sprinted down the other side.
Right.
All that. Remember the Norwegians used to call this running up and down undulating territory as fartlek training?
Oh, yes.
Remember that?
Yeah, fartlek, yeah.
So, they were onto it.
It's an unfortunate name, that one.
Fartlek, yeah.
Yes.
Yeah, but it's memorable.
Very much so. You gas out.
So you could in fact search for on TED Talks. It's something like, can a normal person train like an elite athlete?
Yeah.
Seisler, Sieler is his name. It's a really interesting. It's only about 10 or 15 minutes.
Does the fartlek imply? I know this is a bit off the top. Does the fartlek imply zone 2 then hitting zone 1? Because
no, I think it's more just long, slow distance.
Long, slow distance.
Yeah. I think they build then the other stuff, the higher intensity on top. I think I'm not an expert on that. I don't know.
No, it's fascinating.
Yeah. So here's something interesting. I gave a talk to a group up in the Dandenongs, okay? A colleague and a friend who lives in Berwick but works in Upwey rides a bike up to work. She measures all her, takes all her metrics and all that sort of stuff. So I was talking to her, and she doesn't mind me saying this because I use her as an example and she okays it. She's asthmatic and mouth breather, basically. So I gave the talk and I talked about nasal breathing, the benefits for exercise and all that sort of stuff. So the next day she rode up again, nasal breathing the whole way. So you handed me this data. So I'll give you the what she recorded, first mouth breathing, then nasal breathing. So the distance she covered was mouth breathing and nasal breathing, 36.05 or 36.02, so nothing in it. No, distance is the same. Time, 1.4030, 1.3938, nothing in it. Wouldn't even consider it. Speed, 21.5 k's per hour, 21.7, no different.
Mm-hmm.
Her average heart rate, mouth breathing, beats per minute, 165, nasal breathing, 147.
Yeah.
Big drop.
Big drop, yeah.
Maximal heart rate, 187, mouth breathing, nose breathing, 173. Big drop. So what she's basically achieved, simply by switching to nose breathing, she's done the same amount of work with less effort.
Yes.
So I think that's worth doing.
Yes, absolutely. And people don't really think about this.
No.
So can we ask you a little bit about, how do you improve that?
By improving your functional breathing and your BOLT score.
Tell us a bit about that. And how can we use what we understand about altitude training and so forth?
No, altitude is different again.
Okay.
If you were saying, how do you tell if someone is being efficient or if they've got a breathing pattern disorder or whatever? If you're out and about and you're watching people exercise submaximally, so they might be jogging, they might be walking, and they've got their mouth open, I would say they're not being efficient. They're not getting the most out of what they could do. Again, I did another course up in Sydney at Manly, and we did it at the seminary on top of the hill that overlooks the beach. So we stayed there, did the classes there. And one morning we went down the bottom of the hill, and Daly Road going up from there is long and steep. Goes up to the hospital and the seminary.
Yeah.
So we were gathering down the bottom to walk the hill nasal breathing. The instruction was, you can go as fast as you like as long as you nasal breathe. If you get to a stage where you can't and you've got to open your mouth to breathe, then you must slow down or stop, recover your breathing and go again nasal breathing, to get to the top. While we were gathering down the bottom, this group of 8 runners came through, probably 30, 40-year-olds, running submaximally, but reasonably quick, on the flat, all mouth breathing. So that sort of got our interest, because here we are thinking, nasal breathing, and what are we getting?
There's a point that comes with this where if you do push yourself out of that zone too,
you have to open your mouth.
You get air hungry, you have to open your mouth. Yeah.
There's 2 things. If you're being competitive, okay. If you're not, if you're out training, what I would do in the initial stage is I'd back off and maintain nasal breathing. In other words...
Just like you advised, slow down a little bit, keep nasal breathing.
Keep nasal breathing.
Because you're basically able to perform the same amount of exercise, same kind of power output.
You're oxygenating better.
Oxygenating better, and you're conserving energy.
You are.
Yep.
And the other thing is, a lot of people are competitive, so they don't want to look as though they're... Let's say you go out with a group of 4 riders.
Yeah.
Okay. And you normally keep up, or you normally lead.
Yeah.
Now I'm going to change you to nasal breathing. And you're going to drop to the rear of the pack.
Yes.
You're going to come off the rear. If you're really competitive, you don't like that. Crantock's up the back now. He used to be in the front.
Don't like it.
Don't like it. But my instruction to you would be, go slow now to go faster later.
Because you're building up your CO2 tolerance.
Yes, exactly. Going to oxygenate better when you come back. And, And
then as you get better at doing that, you'll effectively, physiologically, having the higher CO2, the slightly higher pH.
Yeah. And your VO2 max will go up.
So lower pH, I should say, at the tissues is going to, allow you to pull the oxygen off the hemoglobin molecules.
Yeah.
Yeah. Okay.
So now we want to talk about high altitude training.
Tell us about that.
So high altitude training...
We're training high and we're living low.
No, we're training high at where we live.
Right.
Right? So in an ideal world for an elite athlete, they would be living high, training low. Right? Sleeping at a high altitude, training at a low altitude.
Completely the opposite of what I said.
Yeah. Because if you try and train at a high altitude and you're not prepared, you detune, basically.
Okay, right. You just can't put in the
you can't, no.
volume of training that you might need to be at an elite level.
No,
okay.
No. So there's lots of ways you can do it. They put people in a room and, suck the oxygen out, I think is how they do it, and then put them on a bike and get them to work. We can do it, and we judge what we're doing using a pulse oximeter. So remember we said that if you put the pulse oximeter on, your SpO2, your saturation of your blood oxygen saturation will be around about 95 to 98, somewhere in there. That's normal. Then what we can do is we can do it a number of ways, but basically it's called hypoxic hypercapnic training. So we're going to drop the oxygen level and we're going to increase our CO2 level, right, to form an adaptation. Like any training we do, if you want to lift a weight, okay, why are you doing it? You're loading the muscle, you want to get an adaptation, you want it to get stronger. So we're going to put a load onto the body to make it form an adaptation to that load. So hypoxic hypercapnic. So here we go. Put the pulse oximeter on.
Yes.
We're normal.
Done.
So then we walk. Okay. And normal breathing. Then breathe out through the nose. And if you need to, pinch your nose.
Okay.
So you can't breathe through it. If you think you can not breathe through your nose, then you don't have to pinch it. But so, usually to start with, you get people to pinch it.
Keep your mouth closed.
And keep your mouth closed. Now we've closed off. We're working now without any air coming in. So we walk until we get a mild air hunger. Then we increase our walking pace until we get a greater air hunger. Then we jog. Then we jog until that air hunger starts to build. If we need to, we can go into a run until we have to take a breath. We cannot go any further. Release, breathe in through the nose, but get the breathing under control as quick as you possibly can.
Only through the nose, not the mouth.
Not the mouth, just through the nose. So it might take you half a dozen, 8 breaths to get back to where you're feeling comfortable. What will then happen, you'll see the reading on the pulse oximeter drop.
Okay. Saturation.
It'll start to go down. It'll go boom, 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 boom. If we get down to low 90s, we're getting hypoxic. If we get high 80s, 88, 89, we're getting quite severely hypoxic. We wait for the blood saturation to come up again to normal level and we repeat the process. We can do that half a dozen times. What even happens after the first session, the first time you do it, then we do it 4 more, is that you'll get a splenic contraction. So we get a release from the blood bank, the spleen, of fresh blood cells, hemoglobin-enriched blood cell, into the bloodstream. What's that doing for us? It's giving us more oxygen carrying capacity, more haemoglobin, more spots for the oxygen to attach to, carried around the body and distributed to working tissue, organs, whatever.
If you just work hard, exercise very hard, do you get that splenic contraction?
No, because you continue to breathe.
So it's being stimulated by, as far as
we're closing off.
The saturation levels dropping off and the CO2 level climbing.
Yeah. So then we get that splenic contraction. The other thing you do, it'll stimulate the kidneys to release EPO, erythropoietin.
Yes.
So now we're going to
take a longer period of time to...
Yeah, it'll take a longer period of time to work, but what it'll do, it'll stimulate the production of red blood cells from the bone marrow.
Okay.
And then that will come either stored in the spleen or circulating again, after about 3 days. So all these adaptions that are coming on are going to improve your VO2 max and your capacity to do work. If you think about a fire and we're putting oxygen into it, it's going to burn harder, hotter and stronger. If we take air away from it, oxygen away, it's going to quieten down, it's going to die off.
Yeah.
But what we're doing to our body, we're actually getting more oxygen in. So it's going to perform better.
How many of these, we might do 6 cycles?
No, I'd do 5.
5 cycles? Okay,
that's enough.
That's the end of your training. And you might do that how many times a week to try and get the maximum
Every
benefit?
second day.
Okay. And that will be ongoing for a period of time?
Yeah, if you were leading up to an event or, you wanted to arc your training up a bit.
When would you start that? A month before the event? 2 months before?
Well, if you think about the period of time that the adaptation lasts, you're probably closer to the event. I'm not 100% sure that the further out you start it, whether that then your
tails
capacity, it will tail off, but whether you get to a higher level than you were before you started. You lift your baseline.
So would it be maybe 2 weeks before?
Yeah, possibly, yeah.
So we've got a training method there. It's not entirely consistent with high altitude because the CO2 is being held, not being blown off. If you and I went to the top of Kilimanjaro or Everest without any supplemental breathing apparatus, we would be hyperventilating, blowing the CO2 off. So it's not
well, the other thing you're risking, of course, going up there to put yourself under stress. Avalanche, frostbite, pulmonary edema, cerebral edema.
Yep.
Body's under huge stress the whole time. How long are we down here under stress? 6-7 minutes at the most.
Yeah.
And we get the adaptation.
Yeah, we've got the adaptation. So we're looking at, that's the training method we're using for adaptation. But you're holding the CO2 in rather than blowing it off.
Yeah, it's building up. But then when you finish...
You have recovery phase.
It's getting back to what the normal CO2 level would be.
Yeah.
And so is your oxygen level. That makes sense.
I think it's fascinating. Are you aware of people using this method in the elite setting? Say Australian Institute of Sport or wherever it might be around the world.
I think they do it, but in a lab.
Okay.
They've got a room that they
and they might make the room hypoxic. But this
they'll put them on a rower or a bike ergometer or whatever, a treadmill.
I think it's really fascinating that this has become, it's like a new paradigm, isn't it? We're becoming aware of this.
Well, can I just maybe take you to talk about athletes, if they can get a 1% improvement, right, in whatever parameter, it's great, right? Xavier Warrens is a guy who did a study here with our elite rugby players on repeated sprintability. If you think about when we use repeated sprintability, it would be things like basketball, rugby, football, all that sort of stuff. Sprint, recover, sprint, recover, sprint, recover, sprint, recover. So your ability to cover distance quickly and recover quickly and repeat it. Okay. What he did, he got this group and control group, and it was a 40-metre sprint, it was a 30-second recovery, and they did it, I think, 8 times, had a 10-minute rest and repeated it. And they did that once a week for 4 weeks. They tested it at the start, what their repeated sprint ability was, how many sprints they could do. After the training, they had a 33% improvement in their repeated sprint ability. They were doing it breath holding. Right? So they would start the sprint, breathe in, breathe out, hold the breath, sprint. 30-second recovery, breathe in, back to normal breathing, breathe in, breathe out, hold the breath, sprint, 8 of those. And then 10-minute recovery and repeat it. So 33% increase. I think they went something like 9.6 sprints up to about 14 point something.
It's very significant. I wonder if the Matildas are doing that like those.
I don't know.
Those ladies.
But it was interesting, you know. I watched the end of that, or half of that game, and one of the girls, she was standing midfield watching what was going on, breathing through her mouth.
No good.
Well, I would have thought it would have been better to be nasal breathing, personally.
Well,
because she wasn't undergoing it. She was in a recovery phase.
I wonder if we're going to see a change, with athletes around the world in the elite sort of levels, changing to what you're suggesting.
Well, it is overseas. I think it's happening.
Yeah, it's
and it's happening with people are coaching running now, talking about breathing. There's a lot of instructors around that
and Zatopek was he practiced, didn't he, holding his breath. Emil Zatopek.
Yeah, to the point where he passed out.
Incredible.
Yeah.
And
so that was a bit extreme.
Yes.
But what he did the poplar run, of course, which became popular. No, he did the poplar run.
Holding his breath between popular.
Yeah, so he started off, he got onto it, and he started off, he'd run, hold his breath till he got, there was a long row of poplars.
Yeah.
Till he got to the first one. Then he would again try and extend that, so he'd hold his breath to the second one.
Yeah.
And then training him to hold his breath to the third one until he could cover more and more distance with his breath holding.
Lots of small improvements, like it's a Kaizen approach.
Yeah.
And I think one of the coaches of the American swimming team did something very similar. That there was breath holding, and they try to hold the breath, more strokes between breaths, with a record number of wins at the end of that Olympic Games. Yeah. But not everyone believed in this or understood it,
Well, there was a guy years and years ago, I'm talking back in the 70s, say, he was a swim coach in America, James Councilman, and he wrote a book called The Science of Swimming. And Councilman came in and he trained his swimmers with breath holding. Interestingly, he did it on the inhale. So breath in, hold your breath, swim.
Right.
He got excellent results with that. I wonder how he would have gone if he'd done the breath holding on the exhale. Might have changed things even maybe for the better.
So, Allan, thank you very much for running through this. We've talked about nasal breathing. We've talked about the deep.
Light, slow, deep.
Light, slow. We've talked about the BOLT test.
Yep.
Trying to improve our CO2 tolerance. We've talked about the altitude approaches to altitude training, how that will improve our ability to perform. And I think we've very importantly talked about being aware of the core, diaphragmatic breathing. It's extremely important. And I think this can help us in a clinical sense with all sorts of, I was going to say management of a variety of respiratory illnesses. And the physiotherapists probably in hospitals are approaching some of these diseases with this.
You can treat, I've had people in with COPD, but you have to monitor them very closely.
Yeah.
Right?
Yeah.
You can't push too hard.
Yeah.
The gains take a longer time. And even people with anxiety or post-traumatic stress disorder, you can tip them over, right? By they're in this sympathetic tone.
Yes.
And by pushing them too hard, you can push them in further.
Yes.
Which you don't want to do. Could I just perhaps finish with talking about how we can change our state? Now, we get around all day, you've been at work, you're running around, you're doing this, you're doing that, getting home, blah, 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 it's all go, we're ramped up a little bit. Go to bed, we want to sleep, okay? And we didn't really talk about sleep and breathing, but if we want to down-regulate the sleep, a good idea is you get into bed. I will just throw one thing in about sleep. We need a couple of things to sleep. We need it to get dark, and we need the temperature to drop. And we, in particular, need our core temperature to drop. Counterintuitive to that is we have a hot shower before we go to bed. What happens? Peripheral circulation increases and we get rid of a lot of temperature. So our core temperature will drop a little bit. Then get into bed and using the breathing. Now I will use, for example, 4 in, 6 out. So you're lying there, you think about breathing low and breathing light, and you're breathing in for 4, out for 6, in for 4, out for 6. So it goes on. You're thinking about that. So now you're becoming mindful because you're concentrating on your breathing. You're not thinking about other things, right, which can be detrimental to getting off to sleep normally.
Yeah.
So now we're concentrating on the breathing. We're doing something to down-regulate, okay? We're shifting definitely to a parasympathetic state. Do it for 10 minutes. It's a great way to initiate sleep.
Yeah, that's a great tip. Allan, if we wanted to attend a workshop, how would we do that?
Possibly the best way is to go to Health Innovations
I'll put this in the show notes, Health Innovations.
Australia
Australia.
website.
Yes.
Send me a message off that. Yes. Or my phone number will be in there. You can just ring me or text me and I'll come through and provide the details.
I think that will be very, very helpful to lots of people. I'll put that in the show notes. My last question to you, Allan, is when you're available for a crayfish and prawn munch.
Well, my answer would probably be any time that you're paying.
Well, thank you very much, Allan. That's very nice for you to join me tonight.
Pleasure.
Thanks very much. Thank you. I do hope you've enjoyed the conversation with Allan Abbott as much as I have. Thank you for joining me. And I hope you can consider implementing the breathing exercises reviewed in the conversation today. Like many that have already discovered these techniques, including elite athletes, yoga exponents, and the well-informed, I'm finding the practices transformative, and it has been a pleasure sharing them with you. Allan Abbott's contact details are listed below, and I'm sure he'd be happy to hear from you. Next week, we interview another guest, and during the podcast series, we will be covering a wide range of topics across many specialty interests. The discussions are not intended as specific medical advice for patients, but as a general information only and reflect the opinions of the guests interviewed. Requests for new topics to be reviewed and comments about the conversation you've listened to are welcomed and may be emailed to manager@gihealth.com.au.